Welcome back, and tonight we're helping you relieve pain with a technique known as A.R.T, or active release therapy. It's a technique that can help anyone with a soft tissue injury. Joining me now is Dr. Griffin. He practices this type of therapy and is here to explain more about it. What is it?
Well, simply put, active release technique is a movement-based, hands-on soft tissue diagnosis and treatment technique. What that really means is that we will use our hands to assess a problem within a muscle, nerve, ligament, or other type of soft tissue structure, such as a rotator cuff capsule. And when we find that lesion, then we'll use our hands using directional tension in order to relieve the restriction and pain in that particular place.
So what's the most common type of injury that you might run across that people have?
I think probably the most common would be carpal tunnel syndrome. That's the one people probably recognize the most, or plantar fasciitis, where we get restrictions in the bottom of the feet. And so what's really great about active release technique is within a very few number of visits, ideally 3 to 6, we can completely relieve those types of situations and get rid of them in a very short period of time.
So I think we have some video there if we want to roll some of the video and look at exactly how this does work. Or maybe not. There we go. Okay, explain what we're looking at.
Okay, what we're doing here is we're positioning the patient first of all. And ideally what we do is we are going to shorten that muscle, and then we're going to take it from a shortened position to a long position. What I'm doing with my right hand there is I'm applying a directional tension into that muscle. So I've located a lesion or some scar tissue within that particular muscle that I'm treating, and then I use the flat part of my thumb and I'm using a directional tension in order to release that structure.
What's different about that than a good massage?
The massage technique, and although I am a firm believer and get several myself, almost one a week, is that massage typically is more of a compressive type force.
Right.
They're going directly into the muscle. Whereas what we're going to do is find that muscle while it's shortened, and then we're going to go along with the direction of the muscle fibers rather than compressing through the muscle.
Okay, and what other type? You mentioned carpal tunnel. What other injuries are common that you would treat?
Tennis elbow is a very good one. See a lot of tennis players. Golfer's elbow on the opposite side, of course. And you know, the common head forward posture. We see a lot of people now have desk jobs or working at a computer. That mouse is sitting out somewhere on the desk, the shoulder's reaching forward, and a lot of people have developed pain over the right shoulder, in the back of the neck, back of the shoulder, and we can treat that very effectively and very quickly.
Interesting. So is it covered by insurance?
You know, in a lot of cases, active release itself is a covered procedure, but we have to go through it as it's an active motion that we're doing with it, so it becomes a therapeutic exercise or therapeutic activity more than anything. So most of the times you can get it covered by insurance.
Sounds like a good way to get rid of some pain.
Yeah, it's great.
All right.
It's been fantastic.
Thanks for coming in and explaining.
Appreciate it.